Good afternoon and good morning, everyone, and thank you for joining the webinar, Using Technology to Improve Service Delivery in the Justice System. We'll get started in a few minutes to allow for some additional sign-ins past the hour. Good afternoon and good morning, everyone, and thank you for joining us for the webinar, Using Technology to Improve Service Delivery in the Justice System. This webinar will be a virtual panel format and is exclusively for Justice and Mental Health Collaboration Program grantees. My name is Mark Stovall, and I'm a Senior Policy Analyst here at the Justice Center, and I will be moderating today's webinar. For an overview of the webinar today, we'll start with some introductions. Then we'll do some polling questions to get a sense of where you're located and if and how you're using data dashboards within your justice systems. Then we'll have our moderator, Robin Wojcik from the Justice Management Institute, facilitate a panel of representatives from 3 jurisdictions about how to use data dashboards and other technology to improve how services are delivered in their justice systems. And at the end of the webinar, we'll have time for questions and answers from the audience. And I want to briefly introduce our panelists on the webinar. So first up, we have Jojo Liu, who is the Director of the Salt Lake County Office of Criminal Justice Initiatives and Director of the Salt Lake County Criminal Justice Advisory Council. She is a lawyer by training and focused her legal career on defending young people charged in the justice system. Jojo was a clinical law professor for over a decade, focusing on juvenile justice and criminal justice issues. From 2017 through 2019, she was the Assistant Director of the Utah Indigent Defense Commission, where she worked on ensuring that all court-involved youth in Utah are provided effective legal representation in court. Next up, we have Kelly Mcbride. Kelly is an executive-level leader with over 25 years of successful strategic planning and overall development for nonprofit, healthcare, and government institutions. In 2017, she was named Director of Lewis and Clark County's newly instituted Criminal Justice Services Department, where she helped lead the design and implementation of that county's pretrial services program, misdemeanor probation program for individuals with diagnosed mental health disorders, medication-assisted treatment, bridges program, and other collaborative initiatives. She has repeated success in guiding organizations through fiscal and supervisory transition. Additionally, she has a unique talent for composing successful grant applications in both the private and public sector that results in awarding of critical funds. She is an expert presenter, collaborator, and business person with a keen attention to detail, the ability to forge solid relationships with partners, and build consensus across multiple organizational levels. Then we have Tucker Samuelson. Tucker is a performance and data analyst with the Salt Lake County's Mayor's Office of Criminal Justice Initiatives. In this role, he has created several data dashboards with the goal of helping visualize and inform about the criminal justice system. And we have Tamara Silver. Tamara is the Safety and Justice Challenge Project Coordinator for Clark County, Nevada, and an analyst with the Las Vegas Metropolitan Police Department. She is responsible for the continued strategic direction and growth of the Clark County Detention Center as it relates to the development of data dashboards and supporting materials for the Las Vegas Metropolitan Police Department and the Clark County Criminal Justice Coordination Council. Tamara holds an MS in Crime and Intelligence Analysis from Tiffin University in Ohio, and a BS in Behavior from Auburn University in Alabama. She is a proud mother of 4 children with 2 sons serving in the Armed Forces, Air Force, Navy, another son who is a business executive, and a daughter who currently attends Cornell University. And thank you all for joining us today. And for some brief information about the Justice Center, I think most of you know this organization, but we are a national nonprofit and nonpartisan organization that develops research-driven and consensus-based strategies to increase public safety and strengthen communities. We engage in consensus building, original research, policy change, and providing expert assistance at the intersections of criminal justice and behavioral health. We seek to break the cycle of incarceration, improve health, opportunity, and equity, and expand the knowledge base of what works to improve public safety. And the Justice and Mental Health Collaboration Program, as I think most of you know, supports cross-collaboration between criminal justice and behavioral health entities to support people in the justice system who have mental illness or co-occurring substance use disorders. And the Bureau of Justice Assistance, or BJA, is the funder of JMCP grants, and here you can read their mission statement. And I'm going to turn things over to Robin quickly to introduce the Justice Management Institute.
Good morning or good afternoon, everyone, depending upon which time zone you're in. I'm Robin Washi with the Justice Management Institute. Justice Management Institute was created in 1993. If my math is good, that means we're 27 years old. And we provide technical assistance, training, and research in the area of justice, predominantly criminal justice, but we also do dabble in other parts of the justice fields. In 2010, we also created the CJCCs. Whew, that's a lot of letters. The National Network of Criminal Justice Coordinating Councils. And what that is a group of project directors and leaders of the CJCCs in some of the most high-functioning CJCCs across the country, including 2 that are represented on this call, Salt Lake County, which, apologize, guys, that I forgot to switch that slide. It said Salt Lake City, but we really meant Salt Lake County, and also Lewis and Clark County, Montana. Next. All right, Eunice, I'm hoping to get your help here. And Mark, with these fun little polling questions we have to find out a little bit about you all.
Hi, everyone. Good afternoon or good morning. So we should be able to have all the attendees place flags on this map to mark the jurisdiction. If you scroll your mouse over to the left-hand side of where the flags are showing, there should be a white panel with different icons. And if you click on the second icon, it'll say show thumbnail. Oh, actually, sorry. The first icon is the annotation. So if you click on the first icon, there should be an option to put a pointer, which is the second icon with an arrow pointing right. If you click on the pointer, you can see where Robin has clicked her jurisdiction. Yep. Thank you.
Well, great. Well, we are all different time zones, because I think it's, 2 in the afternoon, but it's definitely a little bit earlier for some of you on the West Coast. All right, well, that helps us understand a little bit about where everybody's from. Okay, next. Okay, next.
Robin, I think Eunice is uploading the polling questions into the onto the sidebar.
That's right. And Mark, I know you told me you took them out, but I just spaced that as you saw in my face. I'm like, what? I'm so confused. All right.
Yeah,
so Eunice is going to pull up some polling questions for us, and this is just to help us understand a little bit about what your jurisdiction is currently doing as it relates to data dashboards. So the first question, as you'll see on the right, is does your jurisdiction use data dashboards? A, yes, B, no, or C, I don't know. And I don't know, Eunice, if you want to add anything else about using the polling tool.
The poll should pop up on the bottom right-hand corner of your screen where the chat and Q&A are located. We have about 3 polls to go through, so I will close them in a few seconds to make sure we have enough time for the presentation.
And I think I remember last time I used WebEx, don't forget to hit the submit button. Otherwise, it won't register your choice. Eunice, how are we doing? Do we got a lot of responses so far?
Yes, so I'm sharing the results with everybody. This is for the first poll.
Okay, so I see a few of you have data dashboards, 5 of you. 8 of you answered no, and 6 answered I don't know, and a few of you didn't answer. So we've definitely got a large number of people that either didn't answer or do not currently have them. So next question. Are your dashboards internal, external, or both? Of course, now we're just actually asking this question of you 5, or those that didn't maybe answer the first one but are like, oh yeah, we've got dashboards, if you could answer and hit submit. How are we doing, Eunice? Did we get most of the answers already? Okay, so we've got 4 of the 5, I would assume, who answered. 1 answered both, so we definitely probably will want to hear from you during the webcast, just to warn you. And then we've got 4 that talked about having just internal, and then a bunch of you folks that either don't know or did not answer. So one more question, and it looks like we're just asking this for some of the folks that do have the dashboards. If you can indicate who the dashboards are for, like who is the audience. So here's that last question. And the options we have for you are criminal justice only, criminal justice and behavioral health, or social services. Another option is county leadership, or all of the above.
The poll results should be showing now, Robin.
I wasn't zoning off, I promise. 4 of you indicated that it was all of the above, and 1 indicated that it's just for B, criminal justice, for criminal justice system and social services. Okay, well, now we're going to move on to the main part, which is our panel discussion. And the first person we're going to hear from is Kelly Mcbride. The reason Kelly Mcbride is here to talk to us is her county, Lewis and Clark County in Montana, has been going through a really amazing process of trying to get from no data dashboards to data dashboards. So Kelly, if you could talk to us a little bit about how you got started and where you are in the process and what your biggest challenges are. And don't forget, you've got the 2 slides with the flow chart too.
Perfect. Okay. Thank you, Robin, and thank you, Council of State Governments, for having us here today to share this. So Lewis and Clark County, I think one of our biggest frustrations was having no data. We had an overcrowded jail, as many communities do. The jail was built for about 60 people, expanded with bunk beds to accommodate 86, and typically holds about 120 people at any given time. So jail overcrowding, lots of stuff going on, but never real clear data. Our Criminal Justice Coordinating Council was started in 2012 to really look at that issue. One of the things that they recognized we needed was, some criminal justice reform, and we needed data to know what we were doing, and probably we needed a department. We wrote for the county wrote for a grant to the Montana Healthcare Foundation, received that funding, and one of the things that funding required was starting a department, Criminal Justice Services, and looking at the data. So the department was started, and then fortunately, a mill levy was passed by our voters that helped fund the department. I was brought on to lead the department and really kind of do the formalization of it, and came on in December of 2017. One of the first things we did was we reached out to Justice Management Institute. They did a report and identified we had 18 different data holders, and none of those holders of the data spoke to each other. So we really knew we had to do something. With that report in hand, we hired this past February a project manager to create and follow through with bringing all of that data together. So we brought on our Dr. Thomas, the project manager, and he set out to meet with all of the different holders of the data, which is our Helena Police Department and our Sheriff's Department and our county attorneys and all of those folks that you know in your communities that hold the data. We had each of those create a data flow and a narrative to show all the times that data is touched and manipulated, and who's touching it and who's moving it and where is it going. We wanted to really show where this data is coming from, and in doing that, we identified, of course, data integrity issues. We've also identified, and this was pretty exciting and was not expected, we've identified about $13 to $15 million a year that our county, city, our partners in the criminal justice system have in potential cost savings and cost avoidance. So these data flows were a really big deal. So one of the questions here was, what have been, where are we in the process? We just released a request for proposal to identify a vendor to actually take all of these data flows and this information and create a dashboard that will be able to be public facing. We want to make sure that our public can wake up in the morning, push a button, and know what's going on. We will also have the ability to have permission-based information. So the county attorneys will have one set of information and public defenders will have another set. So really thinking big in this. We're excited to be moving forward to actually have the data so that we can make decisions in our county, in our community. I think I could tell you what our behavioral health population is. I think I could tell you if I'm looking at racial equity. I think, and I want to stop saying, I think I can tell you, and I want to actually give you the numbers. I want to be able to give our community those numbers. And so where we're at in the process is right there, ready to identify a vendor and bring them on and create this dashboard so that we know what we're doing and where we're moving. The other question on this was, what have been my biggest challenges? And I will tell you, even though we do have a criminal justice coordinating council that brings everybody together, we still struggle with silos and that siloed mentality, and that this is my little piece. So that was a little bit tough. However, I'll tell you, once the partners started working on their data flows and their data narratives and started seeing what they're actually doing and seeing where the data integrity is and seeing potentials for cost savings and cost avoidance, we had some excitement and a more willingness to, oh my gosh, this isn't so terrible. This is something that we can do and something we can work on together. So overall, I would say that internal awareness of each of the partners has been big. Really, the biggest struggle we've had is the state of Montana holds some of the data, and those state offices are not interested in partnering with us. So we're working with other counties in a way that we can show the state that at the state level they would be able to contribute greatly on a statewide basis, address some real data integrity issues, and at the state level they would have cost savings as well. So working with now bringing in other counties and working with those other counties on their same or similar projects to ours.
So you ready to show off those really cool flow charts?
I am. They're so pretty.
Eunice, do you mind going to the next slide? You guys got to be ready. You might have to, one more. Wow.
Isn't that so colorful? So I know this is tiny, but just to let you know, this is the Criminal Justice Services Department. That's the department that I get to be a part of. And it shows where the data comes in, where it's touched, where it's manipulated. It's been coded so that the people that know what is happening with this, and it then goes. And if you go to the next one, it's a little bit smaller. There you go. So here's the detention center and where their data is coming in and where it's going out. This is allowing us to recognize every place, again, where the same data is touched and manipulated, which causes data integrity and also has the potential for great cost savings and cost avoidance. So I just think they're also attractive. So there you have it.
Thank you, Kelly. And for those of you, when we did the polling questions that mentioned that you don't have data dashboards, Kelly is a great person, seriously, an amazing person to talk to really talk about how to start. Because I do think that's part of the issue is, everybody talks about data dashboards, but how do you do that if you don't have a place to start? So thank you so much, Kelly, for that.
You're welcome. And I will say it's scary to start, and it's scary even convincing folks to come on board as far as our leadership. But once they understood what we could do with this information and where we can go with this and how we can address criminal justice on a community-wide level, they've all bought in and we're ready to go. So thank you.
Okay, Eunice, next slide. All right, so we're going to now show you some actual data dashboard examples. I also wanted to remind everybody, I know Eunice had already put this in the chat, but if anybody has any questions at any time, we are monitoring the chat. So please feel free to put those in. So if you have any questions for Kelly, as well as our next presenters, we would gladly stop and entertain those questions of anything you may want to know. So now we're going to hear from Tamara. Tamara, as we know, is from Clark County, Nevada, and has really been doing some really neat things with data dashboards and has some great examples for you. And so, Tamara, I don't know if you want to show some of the examples first or just give like an overall picture about the work you all have been doing around data dashboards. Do you have a preference?
I guess I could start with an overview because our dashboards really have different focal points. So here in Clark County, we have pretty much two focal points. You have the executive staff, which would be more of our administrative needs. So those dashboards are going to focus more on aggregate totals. Most of them are going to be statistics related to our population. They most commonly want to see things like booking statistics, release statistics, things that revolve around our average daily population, the average length of stay, and then trends regarding staffing. So we can adjust staffing levels depending on what's going on in Las Vegas. But then more focused than that, we have our population analysis team. And so those dashboards are very specific to that team and the needs of that team, which is population management. A lot of the dashboards that I've created are very detailed, and they get really down into the weeds. So we have things for parole and probation, our treatment bed dashboard. We have a court services dashboard, gang investigations, the mental health population dashboard. We have a hospital population dashboard, inmate programs and services, and then a bail eligibility dashboard. And all of these dashboards are looking internally at our population and allowing us to not only know who's here, but to manage our population a lot more successfully than we were doing without the data dashboards.
Yeah, and I would assume that part of the difference is the difference between sort of the operational dashboards that people really need to do their jobs well, and then sort of the aggregate dashboards that sort of tell people what's going on overarching.
Yes.
Both important.
Absolutely. Yeah, and one of the questions that you had asked me, you said if I had an example of one that had a surprising or interesting impact. And one of the ones we were not expecting was our parole and probation dashboard. As part of our population team, we have parole and probation officers embedded here at the detention center working with us. And their dashboard, right away, we were able to identify that they had a very large disparity when it came to timeframes regarding getting services to inmates that have been arrested on a parole and probation violation. It seemed that the African American community were sitting in jail a lot longer than everybody else. So we started looking at the data and started looking at the individuals associated with the data, and we found out that a lot of the disparity had to do with the discretion that was afforded to the PMP officers. Most of them were dealing with gang members or multiple time convicted offenders, so they would kind of let them sit in jail at their leisure and go about their business and not attend to them maybe as quickly as they would other people. So we brought that to their leadership's attention and, let them know that, hey, this isn't right, because we do have mandates in place, AB 236, where we have to get these offenders calendared within a certain time frame. These offenders were falling outside of that, mandated time frame. So we brought that to their attention, and they were able to address that and bring it more in line. So now we're mandated to do a 15-day calendaring, and we're within 10 days. So we're averaging 10 days right now.
Great. Thank you for sharing. Want to throw some of the examples we have loaded?
Yeah, absolutely.
Eunice, do you mind advancing one?
So this is our daily counts dashboard, and this is used, this goes pretty much everywhere in the facility, but it also goes to our executive staff. It's important to our staff because they want to know how many people we have at the various towers that comprise our facility. And it really came into focus during COVID because we had to move people around. So we needed to know the bed capacity and what we had available so we could structure for social distancing. And it also keeps track of who's at the hospital. So we have an idea of how many inmates are here versus how many are not here, how many are on house arrest.
I like how it looks too. Now, for this dashboard, are folks able to drill in any further, or is it just basically a snapshot that they get to see?
This is just a snapshot, but the dashboard that this comes with has multiple tabs, so they can drill in through our data. It has, I believe the subsequent slides are a part of it. It has it has two booking tabs, like an overview and then a really detailed view of what's going on here in terms of booking. These were created mostly for the sheriff and our deputy chief who need to know specifics, like right away. They don't have time to wait. So they want to just get a picture, like a brief overview of who's here for what crime or who's here for how many days. And these dashboards were created with them in mind. So it pretty much tells them. And this is, oh, sorry.
Go ahead. I was going to have you to explain this one.
This is created for our deputy chief. He's not a clicker, so he doesn't like dashboards that revolve around any form of clicking or manual manipulation on his part. So he told me what he wanted to see, and I created this dashboard for him. As you can see, he likes the Chicago Bears. So I made it very user specific. So he carries this on a tablet with him wherever he goes, and it gives him, pointers and things that the sheriff usually asks. And then down below, I created a chart for him, so it tracks all of our COVID measures. So if he was to be asked, exactly what day did certain measures go into effect, he could scroll over those little dots down there and it would tell him. And so he would know exactly what day they went into effect if he was asked.
And phase casinos, when the casinos started to reopen, yes?
Yes.
Most of the rest of the country doesn't understand phase casino, right?
No. For us, it was huge.
Yeah, I'm sure. All right. Can we see another one? Eunice, do you mind? There you go.
Yeah, this is the drilled in version of the booking analysis dashboard part. So this would be a part of our counts dashboard. It's actually it'd be the third page. But this is if you want to get more intimate and really know what's going on. Sometimes you're at meetings and the focus is always on violent crime and everybody in the jail is a violent offender. But if you really look at the data, you'll find out that most of the time we're booking people for what I call low-hanging fruit, like trespassing or domestic violence or, possession charges. It's not what people really think. It's not assault with a deadly weapon. It's not murder. It's not rape. It's these lower level crimes. And especially here in Las Vegas, trespassing is huge and a lot of the vagrancy issues that we face. So this really demonstrates that. And it also gives them more of a detailed view of the population in terms of race and ethnicity and allows them to check and see. One of the things our sheriff always likes is California, because usually about 27% of our offenders come from California. So this enables him to see those numbers and see what California residents are coming here and doing, or Arizona residents.
Great. I think there's one more, right?
Yeah, that would be the first page. That's the first page of this one. So it's a little bit more pulled back, and it just gives the brief statistical overview. We use this a lot for staffing needs or just for tracking what's going on, especially during events like conventions when we do have them, because you can break it down and look at the days of the week or, the time frame. Certain types of crimes, people that are just being arrested versus rebooked, the types, the severity, felonies. So if the sheriff just wanted to know numbers for felony crimes, he could click on the little felony button and it shows it down there. And it also tracks our progress, where we were last month and last year, that kind of stuff they like to see at the executive level so they know how we're doing.
Yeah, and I really like the bookings by time frame. It definitely shows the pandemic and how that impacted your bookings.
Oh, yeah.
Okay. And then I know I was hoping to also hear from you if you had, if you wanted to talk about a particular challenge you had with getting the data or with a user and the data you were trying to put together, or how you overcame a challenge.
For us, our biggest challenge here is our jail management system. It is extremely not user-friendly. And before I came here and started developing the data dashboards, they really didn't know what was going on with the population in terms of being intimate with it. Our data dashboards really enable us to not only be intimate with our data, but to be intimate with our population. Because at any one moment in time, you can ask me a specific question about our mental health population, and I can go to that dashboard, and not only do I know who's here, I know how many times they've been here, how long they've been here, if they've had suicide attempts, prior suicide attempts, what kind of treatment they're getting, those kind of things. So it really lets us know who's here and why, and identify people that maybe shouldn't necessarily be here and that we can help get out of here. Because that's one of the goals of our population team, is to actually move people through the criminal justice system a little bit faster. And through our work with the Safety and Justice Challenge, we've been coming up with a lot of strategies to move these people from one place to the other. And our data dashboards have really helped affect that change.
Oh, yes, I'm sure. It's like Kelly was saying, she wants to stop saying, I think I can tell you. You can say, yes. I'm telling you, this is what I'm showing you right here.
Yes, or they always try to do correlations that maybe aren't necessarily accurate when you actually get to the cause of the issue. And really getting intimate with your data, you're able to look at the cause and effect more effectively than just supposing. Well, I think it's because we had a convention in town. Oh, well, no, not really. It was because it was really hot and everybody didn't want to, do what they were supposed to do, so they got arrested that day or whatever, those kind of things.
Or like a full moon, for example.
Could be, but in Las Vegas, it's usually hot. It gets hot here.
All right, Eunice, next slide. Okay, well, thank you so much, Tamara. And I know we're going to hear from you again a little bit talking about some of the behavioral health stuff you all have been doing. Thank you.
Okay.
And so now we get to talk to Salt Lake County. And Jojo and Tucker, I'm going to kind of let you guide me through which one of you is going to do which slides. But I don't know if you wanted to do a little introduction first about sort of the general work you've been doing before you show your samples.
Jojo, you look like you were muted.
How is that?
Much better.
Okay, great. My phone was buried. So we're with the Salt Lake County Mayor's Office of Criminal Justice Initiatives. We do a lot of things, but one of the primary things that we do is provide tools and analysis to drive data-driven decisions by our coordinating council and by our stakeholders. And dashboarding has been one of the most important data tools that we've utilized in terms of that mandate. So we've created a variety of dashboards. So like Tamara, a number of internal dashboards focused on particular issues and concerns. We have a dashboard on the intersection between homelessness and our jail, one that tracks sort of identified high utilizers as they move through our system. But one of our biggest projects, and this is really something that Tucker created and he maintains, is our public-facing jail dashboard. So we'll show you some views of that in static form, but I'm also going to go ahead and share right now in the chat the link to the dashboard. And I think this one is, what we could add to the conversation a little bit is some of the considerations and benefits and challenges with dashboards that are entirely meant for the public and utilized by the public. And so before we get to some of those views, I'll just say that some of the takeaways and insights from this project. So this comes from a collaboration with our county sheriff, who is very committed to transparency. And so it's been a great collaboration, and they have really been just motivated and really engaged in trying to make as transparent and accessible, not just to other stakeholders, but to the public in general. And so one thing that we have discovered is in the value of maximizing the data that you have. A lot of times, the data conversation, people tend to focus on wanting to create new buckets of data, saying, oh, we don't track this data. And so how do we do that? How do we create new fields? How do we train people to populate those fields, to fidelity? And sometimes that can't be avoided. If you're not tracking race and ethnicity, then there is no choice but to go ahead and create new fields and to train your staff and to start tracking that. It's going to take a huge investment in resources and time to start getting data that has any kind of integrity when it comes to new fields. And sometimes it cannot be avoided. But we should always look at what data we already have, because the criminal justice field is very data rich in a lot of ways, but analysis poor. So a lot of times there's a lot of data floating around, but we haven't made it usable, we haven't made it understandable, we haven't made it accessible, not just to the public, but also to stakeholders. And I think that's one takeaway we have found with the data dashboard, that the jail data was there. I mean, we did not create any new fields, we did not create a new management system. All it did was pull in from our jail's data management system and put it in a form that people can understand. And it's really allowed for insights, again, not just from the public, but even among stakeholders who actually know quite a bit about the criminal justice system, has allowed for insights and takeaways that were brand new to people, that they started to understand dynamics and drivers and levers that really just weren't visible or understandable before, even though the data was always sitting there. And then the other thing, and I think this is related to some of tomorrow's comments and also to some of the challenges, which I'll let Tucker talk about, is, I think we become victims of our own success, that through this project, it really has changed expectations and norms about how available data should be and how quickly and how accurately. So this public-facing dashboard refreshes nightly, and it is interactive. So at any moment, if you were to click onto our dashboard, it tells you exactly who is in our jail right now in Salt Lake County as of 4 a.m. this morning, and what their characteristics are, and also shows you some trend lines up until this very day, going back a year and a half. And that has really affected the expectations, not just within our county, but also at the state legislative level as a result of this dashboard project, in terms of what data should be available from various stakeholders, how easily accessible, how, that it should cross-filter like this dashboard does, that the public should be able to interact with it and pull out insights that they're interested in seeing. So with that, I'm going to let Tucker walk through some of the slides and also add, Tucker, any insights or challenges that you want to share from this experience of building this and maintaining it.
Thank you, Jojo. Tucker, let's see those slides, man.
Great. Thank you so much. And I hope you all can hear me well. I just put a link in the chat also, which is the link to the sheriff's website where you can view the actual jail dashboard. I hope you all can see that. I would encourage anyone listening to go ahead and pull that up and to kind of, play along with us as we go through this. And, because the dashboard is meant to be very interactive so that you can click on it and you can cross-filter and do things of that nature. So hopefully you all can see it. But if you cannot, if you even just Google that Salt Lake County Jail Dashboard, it's generally the first thing that'll come up. So I just want to say very briefly that I am the data analyst that works with the Mayor's Office of Criminal Justice Initiatives, and I am the person that put this together. Kind of like Jojo said, this is all data that already existed ahead of time. We didn't have to collect any new data or reprogram anything. I mean, this data was already stored by the jail, and so it was just a question of being able to analyze it and put it into a form like this. And if you pull it up, so then this is the first slide, and then this just shows the basic demographic profile of the people who are in the jail at any given moment. And like Jojo mentioned, it refreshes at 4 o'clock in the morning every day, so you can see who is in jail as of right then. It shows a lot of the more common demographic things like age or your race and ethnicity. One we also added, though, was the residential status, which is whether the individual identified as homeless at the time that they were booked, which is, I think, a bit more of an unusual metric, but it is one that we included as well. And so if you can go to the next slide. So this is the second tab in the dashboard, and this shows information about the charges that someone is being held on, including the severity, the category of the charge, whether it was a new charge or whether they were brought in as a warrant, as well as the agency that arrested them as well. Here, though, there is one that I want to highlight, which is the adjudication status. That just shows whether or not the individual is currently serving a sentence or whether they are not sentenced for any of the charges, which is most commonly someone who is pretrial. It could also be someone who has a federal hold or something of that nature. The reason I want to highlight that is because that's been one metric that's been honed in on quite a bit by the public. And I kind of wish I had known it was going to be used that widely because I would have made the graphic a little bit bigger. But it just shows, I think everyone knows that your jail is going to have a mix of people who are serving a sentence and people who are pretrial. But seeing the breakdown was something that was very interesting to people. And this is one of the many insights I think you can get from a dashboard is it allows you to show the scale of things that you already know are happening. So that number is very different now because of the population changes that the jail has made due to COVID. But even if you go back a year, it still would show at any moment that about 60% of the jail was non-sentenced, which is a much higher percentage than people were anticipating. Certainly, you know there's going to be some people in your jail who are non-sentenced, but to see that be the outright majority of the jail, 60% of the population, that was very surprising, and that was something that has helped a lot of people in the state realize that pretrial is something that we need to focus on quite a bit more, as that's such a big driver of our jail population. So if you can go to the next slide. So this slide also is one that's been very interesting for people. This shows the number of prior bookings that people have. Probably not a surprise to most of the people on this call that most of the people in our jail will have been there before, at least once. And you can see right now, for instance, of the about 1,300 people in the jail, about 250 of them are there for the first time, leaving a little over 1,000 people who have been there at least once before. And you can see the number of people who have been booked, 10, 15, 20 times. And as a point of interest, it appears that there's one individual in the jail who's been booked around 130 times, which is something that you will see sometimes in our jail. We'll often have one or two people who have been booked 100 or more times, which is an insight that, again, has been very valuable for a lot of policymakers to see. It's something that if you're on the ground, law enforcement or a correctional officer, you might see that person over and over. It may not be surprising to you. But from a higher level, if you're a policymaker, you might be very surprised to learn that an individual can be booked into the jail 130 times.
Hey, Tucker, over what period of time is that?
This is ever. So this could be an individual who's been booked 130 times over the last 10 years, over the last 15 years. It just basically goes back in the jail database as far as it goes to see how many times that person's been booked.
So thank God it's not over, say, this year.
Yeah, that's true, though. We have seen with some of those individuals that they have a lot of bookings in a fairly short time period. We've even had individuals booked 2 or 3 times in a day, which is something that has happened before. So yeah, that's essentially what that's showing there. So if you can go to the next slide. Now, this is the last data slide that occurs in the dashboard, and this is the only one that shows historical data. So what that top one is showing is the jail population at midnight every single day, going back to the beginning of 2012, so about 9 years or so. If we had a lot longer on the call, I could trace a lot of these little hills or valleys in that jail population to distinct policy shifts that occurred at various times. There was a major law enforcement effort near the end of 2017, and you can see a bit of a spike there. But obviously all of those hills and valleys are pretty dwarfed at the moment by the last about 7 months, which is what happened in our jail as a result of COVID. While the jail took whatever actions they could to reduce the jail population as much as they possibly could to try to prevent the spread of COVID in the facility. And there were days, we've ticked up a bit now, but there were days where we were below about 1,200 people. I think they've even said it was the lowest population they've seen in the jail since the facility opened. So it just, you kind of see that scale just showing it right there. And at the bottom, it shows the number of people released from jail, and then the percentage, that black line, is the number of those releases that were overcrowding releases, simply due to the jail not having capacity, which again was something that's been useful to show some policymakers, that there were days where the jail was having to release 20, 30, 40 people just because the jail was at capacity. Now, those days are obviously very different from a day like today where our population is much lower. But that's essentially what you can see with those. So then if you can go to the next slide. All right, I think this is where Jojo.
Yeah, so now we're going to switch gears a little bit. I wanted to make sure that we talked very specifically about behavioral health and the impact of that as it relates to dashboards, particularly since some of the issues are a little bit more complicated about maintaining privacy of information. So I'm actually going to circle back to you, Kelly, if I could, because I know you guys have been working really hard at trying to figure out how to crack the data nut for behavioral health data. And we actually did get a question already on our call about HIPAA and any issues. Oh, it was from Keith. I'm going to read the question. So when you talk to us a little bit about how you've been able to collect data in the behavioral health area, he specifically also wants to know any difficult issues around HIPAA and how you may have overcome those. So Kelly, I'll let you go first.
Absolutely, thank you. So we have not encountered any HIPAA issues at this point. One of the tools we use specifically for our detention center is, we test drove a couple of different tools to assess behavioral health disorders coming into the detention center, whether that was substance use disorder, mental health, suicidality. We wanted to know what the best tool for us was, and we settled on a tool called the ACOK. We used that throughout the month of August a year ago and found that gave us the best data. So we're using it not specifically, not to say this, not to tie it to one person, but to use it across the board. Once our dashboard is up and going, again, it's not going to say a specific name. Kelly Mcbride has X or exhibits X. It will, it'll be clear, someone of that it's me with different information, but not tied to my name. So HIPAA has not been an issue. But we are starting to really recognize and see some good data, though, coming out from the different data systems.
Great, thank you. And then Tamara, I know I have a dashboard for Clark County that I was hoping that you could talk about a little bit and what the background was for creating that and how that's helped your jurisdiction. And Eunice, if you wouldn't mind advancing one slide. Oh, wait, I'm sorry. Tomorrow's is the next set. So we'll switch and go back to Salt Lake County. I'm sorry, guys.
Okay, I was saying that doesn't look familiar.
Tucker or Jojo, would you guys like to talk about these next couple of slides?
Yeah, this was just an example in terms of how we can use dashboarding and the jail data to help us with, our efforts to better identify and serve and see how we're doing with respect to folks who are experiencing behavioral health issues in our criminal justice system. So this is just an example of something we threw up. I think it was just a couple weeks ago. We were having a conversation around jail release. And so we wanted to see what time folks were released, and then you can sort by their homeless status or whether or not they've been identified as serious persistent mental illness, that designation is SPIMI status, because we were trying to better kind of align how jail release planning and jail release services are done for those groups. And so that's just like one example of how, depending on what you have in your jail data, you can find these intersections. And if you look at the next slide, so here, if you sort for folks who do have that SPIMI indication, you do see that their releases relative to the general population do seem to be a little bit more clustered during regular hours. And this was helping us as a process metric or performance metric to see if we were in fact doing a better job at having those folks sort of like have a warm handoff to programs. And this was, I mean, it's not definitive, but it does give us, right, a process indicator that we're heading in the right direction, that less people who are seriously and persistent mentally ill are being released in the middle of the night. And so that this is an example of, what you can do, in real time to kind of see, if you identify what is it you're trying to accomplish, identify what the indicators that would give you some indicia of, what direction you're headed. You can track those things, depending on what your system focuses at any given moment.
And my question about this is, you said this has been a pretty recent thing. Have there been adjustments now that folks have been able to see the data? I mean, yes, most of it's during waking hours, but I do see a few points there where there's some being released at difficult hours of the night.
Right. So then we are going into the data to find out who those people were and then exactly what was going on. Because what this is showing is that our efforts with respect to jail release and jail release planning are heading in the right direction. They help to identify for us where the remaining gaps are, and then you can kind of then focus in on examples of those gaps and then sort of see what's going on there and where we need to further refine what we're doing.
And then did you have any sage advice about the HIPAA questions? You had any?
No sage advice. So this sidesteps HIPAA, right? Because it's de-identified. And the SPIMI is actually, in this scenario, not a clinical diagnosis. It is something that the jail is, it's not, for the purposes of HIPAA, a clinical diagnosis. So, like everyone else, we run into problems when it comes to HIPAA information. During this legislative session, there is going to be a big push around data sharing in the criminal justice system, and they are very aware that they need to crack is HIPAA. And so there's conversations about, how to find ways. I mean, obviously state law is not going to be able to change HIPAA, but, some of the things they're talking about is, making sure that all the stakeholders are aware of what sorts of waivers, folks can sign as it comes through different points of contact in the system, incentivize, kind of educating people about waivers and getting waivers through funding those stakeholders around that topic. So it's definitely something that Utah is now very engaged in discussing, and we hope to see something that will give us more tools going forward.
Great. Thank you, Jojo. And now, Tamara, I'm pretty certain the next slide is yours.
Sorry, I had myself muted. Okay, so we break down behavioral health, substance abuse, social services into a variety of different categories. So this would be an example of our treatment bed dashboard, and this is used by our population analysis team. We have a treatment bed officer, and it's to facilitate people who are court-ordered to treatment getting to said treatment bed in a reasonable amount of time. And this dashboard became especially useful with COVID because just because you're supposed to go to a certain treatment facility doesn't mean we can necessarily get you there because everybody's losing funding. Some of them have limited bed space now. So we've had to revolve people per se. So this dashboard has been useful to help us identify people that maybe necessarily aren't going to get where they're supposed to get. So we can get them back on the court calendar before a judge so we can get them to a different treatment facility in a reasonable amount of time. Because some people before this dashboard were sitting here, 30, 60, 90 days waiting for treatment beds. And with COVID, it got even longer. They wouldn't take them. They had lost funding for, say, a female. So we had a female we had to place. So it's really helped us identify who needs to get where in a more timely fashion. We also have our mental health population dashboard, and how we get around the HIPAA is the population team are intimate with these inmates. It's the mental health providers, it's the psychologists and the doctors and nurses that are on staff. They're the only ones that actually see the detailed dashboard, and that's created for them to use to make their jobs easier. Aggregate numbers would be seen by people not part of the mental health team. And we also have alert coding. So that's available to anybody who uses a jail management system. So you can see if an inmate has maybe a history of suicide attempts, or he will have like a red notation next to his name. So there's something. You might not necessarily know what his condition is, but he's being medicated for a mental health issue. So not to maybe mix him with somebody that's not, or to take him off a specific floor. So we do have those kind of measures in place. But our mental health dashboard is very specific to the mental health professionals. But we do have a hospital population dashboard that we use to monitor people that go to the hospital because sometimes their conditions can be severe to where they're not necessarily going to be back in a timely fashion. And that's just a drain on our resources. So we go back to court, work with the court system to get them, say, released to family or released in another fashion to where they're not taking, you know, because officers have to sit there with them when they're at the hospital. So to where they're not drawing away our financial resources. And then we have dashboards aimed at what we call resource-resistant inmates, who are your frequent flyers that are usually incarcerated multiple times a year for a variety of, usually it's vagrancy or trespassing kind of charges. These people are usually either unemployed, homeless, you know, somewhere, shape, or form, you know, maybe have substance abuse problems, but are not as likely to have the resources to get out of jail themselves. So we use this, it's called the bail dashboard, but we use this dashboard to identify inmates that have been offered bail, but maybe don't have the financial means to actually post bail. So we try to work with the court system to find alternative measures to get them out of custody. And we look at their criminal history and what they're charged with, and, you know, if they're a flight risk and all those kind of things. We have a needs assessment that that they take. And so we identify any kind of issues that they would have if they're a candidate for possibly just being OR'd or maybe put on electronic monitoring instead of given bail since they can't pay it. So that try to facilitate getting them out of jail quicker so they're not being housed unintentionally for long periods of time just because they can't pay, say, $500 worth of bail. Sure.
Okay, so we have one additional part I wanted to go through. Eunice, next slide. So I wanted to talk a little bit about the narrative. And before we do that, I think the one other thing I'd love to just add to the conversation, particularly those of you that haven't gone down the data dashboard road yet, is that it's very common to come up against stakeholders that are really resistant to this. You know, there's people that just really don't, they're afraid of what the data may show. And when I've had the chance to go out and provide technical assistance, you know, some of the ways that I've helped overcome that is to just really be patient with those stakeholders and talk about how the aggregate doesn't really does a better job of not divulging privacy type issues, and then also using the ability to have dashboards to make everybody's life better, both those that are the numbers in the dashboard, be it the people in the jail or whatever, but also the stakeholders. You know, anytime you have that information, it can help provide better answers to how to respond. And sometimes it takes a long time to break down those challenges, but after a while, and usually what you try to do is try to find an easy, low-hanging fruit on something that maybe data that's already there. Jojo talked about this with the jail data. Jail data is already there. Everybody knows there's people in jail. Many places already have some of that information up on websites, so it's not private data. It's just trying to take it and making it meaningful data, as Tamara has done in Clark County. And so to bridge that conversation with where I'd like to go next is talking about the narrative, because the other really important issue here is once you have a data dashboard, that's great, but you need to make sure that people understand that they did data that they're looking at. And I know Tucker touched on that just a little bit, but Jojo, I really wanted you to speak to this issue because I think particularly having the external and the internal dashboards, you've really had a great taste of how the dashboards can really be powerful for not only the stakeholder community, but the larger community. And you're on mute.
Have to put it right here in the mouth. Okay, so in terms of getting buy-in from stakeholders, not to be afraid of transparency and data accessibility, you know, in our scenario, we were just really lucky. We had elected county sheriff that just kind of out of the gate really, you know, wanted to do this. But I think that in terms of also getting her team and her deputies on board, I think that Tucker was really, really strategic and smart in that he was simultaneously not just building a public-facing dashboard, but also trying to solve management issues that they had, right? Because in terms of incentivizing that kind of participation, you have to have an immediate upside to the folks who are helping you with that project to see how it is that something like this can improve their workflow, make their life easier. But that case study, it's really been extraordinary how much is taken off. Again, I think we're the victims of our own success. Now all kinds of partners in our system want to create dashboards, want to make our data more transparent. In fact, one of our, I'm not going to go into details, but someone has asked us to do a data visualization and provide transparency on probably what is our most controversial criminal justice issue and the most polarizing one we have related to our jail. And so we're just going to take a stab at making it completely transparent, both in terms of process as well as numbers as in performance, because the experience of our sheriff has been that, she used to get all kinds of questions about what was going on in the jail in terms of, race, in terms of, offense levels. And now she says, well, here's a web link and you can go look, and they do. And she says, and the amazing thing is they never come back with follow-up questions because it's just there for them to look at. So that's been kind of our experience. I think we've just been really lucky with respect to getting engagement from our stakeholders.
Jojo, it's getting hard to hear you for some reason. We can hear you, but you're really better, much better.
Is that better?
Much better.
Okay. All right. And then in terms of having this data be a lever for change, so Tucker touched on this. So one of the things that people really fixated on with the jail dashboard was the extent to which our population is pretrial. So has not yet been convicted of anything, was still having the benefit of the presumption of innocence and how many of those people were in our jail. And the thing is that everyone already knew this from an anecdotal perspective, but the fact that the data was up to date, I think lent a sense of urgency and legitimacy to that information. And so the year after the jail dashboard was built, there was a bill in our state legislature to basically reform our cash bail system. And certainly a lot of things went into the success of that bill and the fact that it passed and the fact that we're now implementing an ability to pay matrix. We now have a requirement that judges impose the least restrictive conditions in terms of pretrial. We're also implementing unsecured bonds versus secured bonds, which is going to make a very big difference in our pretrial system. And so a lot of things went into the success of that bill. But to the extent to which data played a part in it, the dashboard was used and mentioned many times because at any given time, if someone's trying to make a point about the pretrial population, the amount of bail that people had, how many people were in for X amount, you can just pull it up and it's right there and it's up to date. And it lends, again, a sense of legitimacy and urgency, I think, to the topic that wouldn't have been there if the data had been static. And because then you have to kind of rely upon that source. Whereas the jail dashboard, all it is a reflection, an accessible reflection of our jail management system. And anyone can take a look at it. Anyone can slice and dice it. And I think it just lent just sort of a sense of urgency to that information that otherwise wouldn't have been there.
Thank you. Tucker, did you want to add anything onto that?
Yeah, just very briefly, just kind of what Jojo said in terms of getting the buy-in from the sheriff's office here. And I think what was really key for us is not just that we were getting permission to use their data to inform the public, but that what we were doing gave them a lot of value also. And kind of like Jojo mentioned, like they use the jail dashboard all the time. For them, they see it as a very functional piece of their job, as like a really easy way to educate the rest of the public as well. And in so doing, they've wittingly or otherwise become big advocates for us and kicked off other agencies who want to reach out to us and do similar things. But kind of starting with what we had, which was the jail data, and creating something like this is really is making it much easier for us to move on and do some other projects as well.
Thank you. And Tamara and Kelly, I know this is really mostly Jojo, but I just want to know if you guys have anything you'd like to add about the narrative.
Well, I will say for us in terms of stakeholder buy-in, our agency is really huge on transparency and relationship with the community. So this has been a huge tool, and our entire agency is actually adopting it on the other side of the house. So the law enforcement side is also going to be developing dashboards to display their data. They're in the beginning stages of developing them because of the successes we've had here at the jail. But we've used these dashboards in so many meetings and other forums, and people like pictures. And so it's very easy for me to do a really great report with a bunch of tables and charts and all kinds of graphs. But when I can pull this up in a live meeting and start clicking and using the cursor and answering questions with this data, and it's live, that really gets them, because then they can't refute it. Because, you know, I believe Jojo was the one that said, you know, here's your data, it's right here. You can't say, well, you manipulated it a certain way, you know, or your statistics aren't right. It's right there live for everybody to see. And it really makes a big statement.
Well, and if I may add, I've had the pleasure of being in some of those meetings where data is just starting to be used by a community, and watching a community that's doing I think it's this, back to what you said, Kelly, and the anecdotal, well, you know, I had this guy in my court and he did A, B, and C, to having the actual aggregate data of what's actually happening, and watching the community like make decisions based on that graph or that pictorial representation of the data it's practically breathtaking. All right, so we still have a little bit of time. If anybody has any questions, you know, please feel free to put those in the chat field. And then I think we just have one other slide coming up after this, which I think comes back to you, Mark, if I'm not mistaken, as we wait to see if anybody has any more questions.
Yeah, and Robin, another question came in about when inmates have mental health issue, is there a direct link to referral to mental health services from the jail using those data dashboards?
Oh, great. Yeah. Which one of you would like to take that? Tamara, I know you had a little bit of the behavioral health, or maybe Jojo preference?
I mean, I can just talk to the fact that when the inmates get arrested and come here, they automatically appear on our mental health data dashboard because it recognizes the certain codes that I've put into the system to identify them. So our mental health team is aware of them being booked as soon as they're booked into the facility, and they can begin the process on their end of what needs to be done from their perspective to assist them in transitioning through the criminal justice system. So I know they're huge because our psychologists and psychiatrists are, you know, coming on shift first thing in the morning, and the information is right there ready to go. Same with the hospital log, it's right there ready to go. So nobody has to run reports or answer emails or even look through their emails. You just pull up your dashboard and everything you need is right there in front of you, and you can start making decisions how you're going to spend your day from the get-go.
Jojo?
Yep, in Salt Lake County, I had mentioned we had a high utilizer dashboard. So those were folks that were already connected in a previous release setting to kind of wrap around case management. And what that dashboard did was push out an alert to the case manager if any of those identified individuals were rearrested and booked. So then they can, you know, go to the jail, know where they are, know where to find them, know where to kind of re-engage. And then we don't yet have, we're just in the beginning stages of talking about having kind of permanent jail release planners at the jail. But that's also kind of on the other end, right? People who are not yet connected, we're sort of hoping to stand up that asset and using the jail information we have to identify who are folks that are going to need a little bit more intensive jail release planning for.
Thank you for adding that, Jojo. I forgot that you'd shared that with us in our planning call, and I thought it was just so wild. So yeah, thank you for talking about the text messages that alert everybody when somebody gets into jail. Do we have any other questions in the chat?
And Robin, another question that came in privately was, what are future plans for using the data dashboards? So now that you've got them up and running, like what are the future plans?
Jojo, you want to start with that one? It's still on mute, even though I saw you touch your phone.
It says I'm unmuted. Can you hear me?
There you go. Yeah.
Okay. So actually, as a result of planning for this webinar, we're going to do what Tamara does with her dashboard. So, you know, our dashboard was much more sort of like, here's all this information, you know, it's kind of descriptive as opposed to focus on a particular prescriptive aspect of how that data could be used. And so now with the implementation of bail reform, you know, the way that Tamara, she takes it kind of one step further, right? She uses that data to say, well, what should not be happening in our jail, right? Get stakeholders around this topic of, well, we shouldn't see X in our jail, right? We shouldn't see folks with low-level amounts of bail who've been sitting there for more than however many days. And then have that trigger stakeholder discussion and behavior around whether or not we can change the status of that person. And so I think what we want to do is get our stakeholders together and say, well, with the implementation of cash bail reform, what should we no longer see in our jail, right? And then create a dashboard that would then specifically let us monitor when we see circumstances that we shouldn't see anymore, and then have that trigger conversations about whether or not that case needs to be reexamined.
So kind of like a jail review team.
Mm-hmm. Yeah.
And Tamara?
There we go. Well, I know the more I build dashboards, the more people want them. So it's just a matter of people asking, and they pretty much get what they want in terms of knowing the data. But one of the things we recently identified, we have a racial and ethnic disparity working group, and the sheriff asked me to look at the data from the perspective of visitors, because it's one thing to look at our bookings and releases in terms of the demographics that make up Clark County, but how many of the people that are being booked and released don't live here? So they're impacting our demographic from an arrest perspective, but they don't necessarily live here. And one of the things we identified was that a large majority of our out-of-state arrests for prostitution are actually from California, but what we weren't expecting was that they're African-American females. So we're working closely with some of the diversionary groups aimed at prostitution to work with these females when they come in, so we can see if we can identify perhaps a pipeline, a trafficking pipeline leading back to California for the sex trafficking, because we have a lot of crossover when it comes to gangs and the pimping and prostitution related crimes from California. So now if we can maybe identify that nexus and see who's bringing them in here, because it was an extra large amount of prostitution-related crimes, and it's usually not our African-American females that are making up that demographic. So it's very interesting to see. So it's opening our door to actually look more detailed into our data from a variety of different perspectives and try to see if we can impact, you know, the overall makeup of our jail.
Yeah, it's really able to get very granular with what you're looking at. That's really exciting. Any other questions, Mark? Do you see?
No, I didn't see any others come in. And we can probably jump to the next slide here. Robin, do you want to talk a little bit about this, or do you want me to start and you can jump in?
Yeah, and this was the slide we had in the last webinar that I helped with, so I just left it in there just to remind folks, but I'll let you talk about it, Mark, because I'm pretty sure you know more than I do.
Sure, yeah, so for grantees who are on the line, we have an opportunity for one-on-one consultation with Robin and her team at JMI, and specifically focused on issues of engaging representatives in your criminal justice and behavioral health systems. And I think some of the grantees on the line today might have actually been involved in those consultation calls, but just a reminder that this opportunity is still available, and to be in touch with your technical assistance coach about setting up this opportunity.
And I just want to give a huge thank you to our panelists. You know, the dashboard work is so important to justice, criminal justice, and words cannot express my gratitude to sharing where you are in the process and sort of the successes and challenges that you've all had. So thank you so much.
Yeah, I want to echo the thank you as well. A big thank you to our panelists, and thank you to Robin for facilitating and for doing the Q&A for us. And we did record this webinar, and we'll try to have a recording posted on our website and make it available to grantees by around this time next week. And feel free to reach out to me, and I can route the request to the different panelists if you have follow-up questions.
Thank you, everybody.
Thanks, everyone. Have a good afternoon.
Thank you.